काफी स्लो चल रहा है तो एक आवाज एक ही सेकंड रुक जा भी के लो तो
Today is 7th of April, which is celebrated as World Health Day. The World Health Organization has instituted this day in order to increase awareness about the importance of health and well-being. In the wake of the recent pandemic, the rising pollution on the planet, as well as in the increased incidence of non-communicable diseases, the WHO has decided to focus this year's World Health Day on improvement of people's health as well as that of the planet. The World Health Day 2022 slogan is Our Planet, Our Health. Good evening, everyone. I am Dr. Siddharth Shah, Consultant Orthopedics and Joint Replacement Surgeon at SL Raheja, a Fortis Associate Hospital in Mahe. Welcome to this FB Live session. Bone and joint disability or bone and joint problems is a leading contributor to ill health. The recent pandemic has resulted in drastic changes in our lifestyle, working patterns, as well as dietary habits. Work from home became a norm for most of the Mumbaikars in the last 2 years. This has had a significant impact on our bone and joint health. We have seen a surge in the number of patients presenting with musculoskeletal problems in our orthopedic clinics across Fortis hospitals in Mumbai. In order to understand more about this alarming trend, our teams at Fortis Hospitals decided to reach out to Mumbaikars through a survey in order to understand about their understanding about bone and joint health. This survey was conducted over the last 2 years, and we had a very large sample size of over 5,000 respondents. Nearly 65% of the respondents were females, and about 61% of them belonged to the age group of 18 to 40 years. Now, to deliberate further on the findings of this survey, I have with me an esteemed panel of orthopedic surgeons from across the city of Mumbai. I would like to introduce Dr. Sachin Bhonsle, who is Senior Consultant Orthopedic Surgeon from Fortis Hospital, Mulund. Dr. Kaushal Malhan, who is Senior Consultant and Director of Orthopedics, Fortis Hospital, Mulund. Dr. Manish Sontakke, Senior Consultant Orthopedic Surgeon from Hiranandani Fortis Hospital in Vashi. And Dr. Manan Gujarati, Senior Consultant Orthopedic Surgeon from Fortis Hospital, Kalyan. It is my privilege to welcome you all. Without further ado, we will start discussing on the findings of our survey. And I would like to begin with Dr. Bhonsle. Now, from the beginning of this pandemic, we are hearing this term, this concept, work from home. It is very popular, very prevalent. What do you think is the effect of working from home on an individual's bone and joint
Hello, friends. I'm Dr. Bhonsle from Mulund. Work from home. That's something which I had never heard of before the pandemic started. It's been almost 2 years now, and as soon as the lockdown started, and most of the employers to most of the employees said that you guys start working from home now. So that's what is work from home, and there are few people who benefited from that. There are few people who suffered because of that. So work from home scenario has been such that majority of the people in the city of Bombay and even worldwide have been working from home, and those who could not work from home, like us doctors, policemen, firemen, other healthcare workers and so on, could not work from home. Now, during work from home, people experience lots of problems. Some of them because they were not able to do the work from household work at home. Number one. Number two, people who had to work from home did not have adequate facilities, infrastructure at home to follow the ergonomics of practice, so that they suffered during this work from home area. Third thing is, those who were exercising regularly could not do the exercise, and being homebound, their exercise schedule changed. And fourth, most importantly, the mental health suffered in addition to physical health during the work from home phase.
Thank you, Dr. Bhosle. You have very elaborately covered each and every aspect, and that kind of makes my job a little easy. I'm going to touch upon most of these points in our subsequent discussion. So, my next question is to you, Dr. Malhan. Uh, our respondents, 73% of our Mumbaikars said that they did not have a functioning ergonomic setup at home to work efficiently. How do you think this affects an individual's bone and joint health?
Yeah, at the outset, thank you for inviting me here. And one of the things we noticed during that period, the 2 years when initially there was a lockdown and later, uh, people were working from home, was that we saw a lot more patients with neck pain, with upper back pain, shoulder pain. And these are patients who, these are problems we normally associate with poor sitting habits. We see it a lot in the IT industry where we find people sitting for long hours, sometimes working long hours. And what really happened, as Dr. Sachin said, that people were sitting much longer ergonomically, they were not doing the right thing. And therefore, we did see a lot of patients who presented with those kind of problems. And certainly, a large part of our treatment plan in those cases was to help them understand what they were doing wrong rather than just giving medicines.
So I would just like to add to what you have said. Now, typically, my experience has been that when patients come over, they would tell me that when they are working from home, the working atmosphere is very casual. So either they are working whilst lying in the bed, they could be just sitting on the sofa while working, or they may just sit on bean bags. They may not have a dedicated workspace while they are working from home, and this is having an effect on their posture. So I usually ask them to have a dedicated workspace in the house if possible. I ask them to keep the computer screens at the level of their eye so that they don't have to bend their neck or back excessively, which will put a strain on it. I ask them to adjust the height of the chair such that their hips and knees are rested at about 90 degrees and their feet are not hanging in the air. I also ask them to make sure that the wrists and elbows are well supported, and I do tell them to make a point that after every hour or 2 hours, do try and get up and take a walk around, try to stretch a bit in order to reduce strain on the joints. And I have patients coming back and telling me that these small changes have made a lot of difference in their problems. So to take this further, my next question is to Dr. Gujarati. Now, our survey found that 41% of the Mumbaikars said that they spent over 8 hours of their day in front of the screens while working from home. And about 18% of them said that if they are not looking at the screen, they are actually on their mobile phones. Now, we know how ubiquitous the use of mobile phones has become. One can do almost everything with the help of their mobile phones. They can shop, they can order their food, they can execute their office tasks. And when they are not doing these, they are, either on social media platforms, they are texting or browsing, and all this is leading to reduced physical mobility. So, Dr. Gujarati, how do you think this problem of reduced physical mobility is affecting the bone and joint health, and what can individuals do in order to address this issue?
Yeah, so thank you, Dr. Shah, for asking this question because this is a very pertinent point. Time and again, we hear this cliche, that sitting is the new smoking. So in the 40s, when in the 1940s, people used to smoke casually, and later on, a couple of decades later, they found out that smoking is so dangerous. It's causing so many cancers. So currently, what we have found as a medical community is that when you're sitting in the same posture, in the same position for hours on end, your spine muscles, your neck muscles, your postural muscles, core, they all get fatigued out. They don't get proper exercise. The joints may end up becoming a little less well lubricated. The tendons may become a little stiff. And in order to circumvent this, we actually have to make sure that every hour to 90 minutes we get up and kind of restart our system, which is gone in the standby mode. Unless we do that, whether we are working in the office or at home, we will keep on having these problems such as overuse injuries such as tennis elbow or carpal tunnel, or axial back pain and neck pain, trapezitis. So yeah, I agree with you that regardless of the pandemic or not, this is one core issue that needs to be addressed.
Thank you, Dr. Gujarati. Moving on, my next question is to Dr. Sontakke. Now, our survey found that nearly 75% of individuals who are working from home did report some or the other type of pain or discomfort. Now, this could be in the form of pain in the neck, pain in the back, or stiffness along the spine, or tightness of the muscles in the legs, or just tingling or numbness in the arms and legs. I'm sure you would have seen a lot of patients coming to you with the so-called cyber slouch or a text neck or a hunchback or just a text thumb. So, what has been your experience about patients who present with musculoskeletal problems whilst working from home, and what do you attribute these to?
Thank you so much. I'm Dr. Manish. I'm from Vashi, Fortis. Um, 90% of the patients have to understand what is happening with them, first of all. I explain them that 100% of our work we do it in bending forwards. Moreover, most of these patients were sitting for a long period of time in their chairs. They didn't understand that they're losing their muscle mass and they're losing their bone mass. Most of these people thought that working at home, like doing household chores, usually is an adequate exercise for them. But they didn't understand that they needed to do the right kind of exercises. So the awareness for people regarding back extension exercises or leg extension exercises is very, very less. Moreover, awareness regarding these issues is another problem is that being at home, most of them were severely vitamin D depleted. So we found a lot of patients who were severely vitamin D deficient that causes a lot of muscle weakness and indirectly causes these symptoms directly or indirectly. So to tackle these problems, most of us we put our patients mostly on rigorous physical therapy. We ask them to do any kind of exercises. Might as well be brisk walking for 25 minutes or half an hour. Do some kind of extension exercises, like Surya Namaskars or any kind of physical activity in which they don't have to bend forwards as such. And building their core muscles have helped them a lot with vitamin D supplementation.
Thank you, Dr. Manish. One of the things which I also tell my patients is that whilst they are working, they must try and keep their neck and the backs straight. Another thing is obviously the use of mobile phones, and typically, whilst one is using a mobile phone, the neck is excessively bent forward. And now there is a lot of evidence to show that more the forward bent or more the
Bend,
angle,
exactly.
uh,
Yes.
the greater is the strain on the neck, which eventually is going to result in long-term problems. So the straighter their neck is while using mobile phones or digital devices, the more they will be protected from long-term problems. So carrying on, Dr. Malhan, I want to share another interesting thing that when our respondents were asked about what they attribute their musculoskeletal problems to, 26% of the respondents felt that it was indirectly or directly related to a disrupted sleep cycle or inadequate sleep. In your opinion, how accurate do you think this is, and what could be the other factors for musculoskeletal problems?
No, I certainly feel that this was a very telling time on public in general. And as you mentioned earlier, it was not a physical issue, but the mental issues were a significant part of the whole problem. And people had old people who could not go out, and there was family members who could not leave the house at all. There were no maids coming in, there were no servants for a lot of people. There was a completely different lifestyle for everybody, including work from home. Kids were not going to school, and there may be families with little kids, managing them, long hours for them, and then trying to manage the kids at home. So there were a lot of other issues, including family issues, social issues, which were, I think, a disruptor in the real sense. Leave alone the work issues, leave alone that they could not do the normal things which they do in the daily routine to enjoy life. Going gymming, is a simple thing. Gyms were closed, swimming pools were closed. You could not visit anybody without offending them. So you would, probably, I think the best way to talk to somebody would be see them on a mobile or something rather than physically going to see them. And I think that did play a role, and probably the kind of lifestyle people were in, maybe they were sleeping late, maybe they were not getting enough sleep. But yes, they had pain. We already spoke about a lot of issues which cause pain: back pain, neck pain. And you yourself also mentioned how, and I have noticed it so often, when the patient comes to me, the wife actually tells me that now he never sits properly in a chair. He's always slouching in a sofa. He's always lying in bed, with a big pillow behind the head and trying to spend the day with working. And that it took a toll on everything. And I think it is a mixed thing. It is a physical issue, it's a mental issue, the whole social cycle got disrupted. And I think that played a role. Yeah.
So it's very interesting since you mentioned about the social cycle being disrupted and how individuals, while working from home, they also had other responsibilities. So 56% of our respondents said that apart from working from home, they also had to look after the schooling part, they had to take care of the elderly people, and they also had to complete household chores. Now, typically, before the pandemic, when children would be sent to school, and before the children would come back, that is the time when the individuals would have the time to themselves. But now with online schooling, uh, people have to stay with the child during the duration of the school as well, which means more is expected out of them, and this obviously is going to have an effect on their working as well and disrupt their sleep cycle. So, carrying on from there, Dr. Manish, one interesting finding that we found in the survey is that when people had pain and discomfort, 70% of them would resort to some form of heating pad or massage oil, use of some brace, or they would just do self medication. 30% of the people did not do anything, and only 4% of them would consult a doctor. Now, don't you think this is a little worrying trend where people are not seeking professional opinion but are resorting to self medication or other means? What is your opinion on that?
Like, definitely. That was a major issue during that time. So, first of all, people were really afraid to come out of their houses. They were not allowed to, in fact. And approaching a doctor, though we were available through teleconsultations, the amount of responses that were there were really low. Most of these patients came in distress. When the problem was very severe that they could not manage at home. That's the time when they came to these household remedies that they try to do. They don't understand that these remedies all work at the skin level. They don't actually treat the disorder as such. It gives them a temporary relief for 10 to 15 minutes but doesn't treat the actual ailment or cause of the treatment. So the number of patients who had come during this time were really bad. I mean, there were patients who had previously minor osteoarthritis changes because of lack of activity, because of lack of exercise. Their arthritis has progressed, their back pain has progressed. So they were practically from household ambulatory patients. They had become to bedridden patients, most of these patients, and they came to the casualty during those times with severe problems. Some of the patients who have come during those times were predominantly who had suffered elderly people who had suffered osteoporotic fractures during that time. And these remedies, usually the people do try to use them for the first 2 days, but when they realize that they are not able to, they're not going to have any kind of relief through that, they did approach the hospital during that time.
And I think you have very rightly elucidated that how delayed treatment or seeking delayed medical attention has actually resulted in worsening of the problem, and people have ended up requiring perhaps a much higher level of treatment
Treatment,
for a
exactly.
problem which could have otherwise been managed simply only if they would have taken timely treatment.
Yes.
Now, at the beginning of this pandemic, we know that we were postponing or delaying elective surgeries and were only performing emergency work. Now, when we asked our respondents about what they did when they were to undergo a scheduled surgery, two-thirds of the people said that they had delayed their surgery. Now, interestingly, of these two-thirds, Half of them, they delayed their surgery with the consent of their doctor. So the doctor said that yes, this treatment is not very time sensitive and it would be okay to postpone it for a couple of months. Or the doctor has given certain medications which will help them tide over this period. But we have nearly 26% of patients who did not undergo surgical treatment because they were too scared to go to the hospital. My question is to you, Dr. Bhosle. In your experience, what happens now when these patients come back, say after a period of a year or two, to you, and they have postponed their surgery? They possibly have got a worsening of their existing problem. Has the surgery become more complicated? Are the outcomes going to be affected if they delay surgery? What is your experience on this?
Thank you very much. There are especially two or three types of patients who have suffered a lot during pandemic. Mostly elderly. Number one, hip fracture patients. Hip fracture elderly need immediate surgery and need immediate physiotherapy to get on with the mobilization. Only then they get better. Otherwise, there is a risk of death within a year. Many of the elderly who had hip and vertebral fractures were lying around their house even as long as 2 to 3 weeks or a month, and that was enough to make them permanently weak and a very high risk for surgery. And some of them, unfortunately, did not do well. I have had certain interaction with people, and I have been stressing this point. In addition to that, those with osteoarthritis of the joints, knees, and the hips also suffered because they were at home. They were unable to seek consultations, or they were afraid to seek consultations. We were unable to do elective surgeries like knee replacements on routine basis during the pandemic. So we had to delay these surgeries either as well. And these people became weak and sometimes bedridden at home, and not such a good risk for surgery. However, as soon as the pandemic started to wear out, we started doing some elective work and started to prioritize these patients. And it's important for us to maintain the connect with our patients, especially who are elderly and arthritic, to come forward and now start take the treatment. Thank you.
So, in your experience now, has the deformity become more severe? Has the surgery become more complicated? Do you think it will have an effect on the outcomes when they undergo surgery, say 2 years later?
Certainly the surgery has become more difficult, and as a result patient will have to work harder in terms of physiotherapy to get good results. Fortunately, our hospital Fortis has got infrastructure, has got team, and has got the expertise to deal with the most complicated cases. So we've been doing such cases even in the past as well. So it's not a new thing for us to deal with such cases, but patients certainly would have had a easier journey in their recovery couple of years earlier.
No, I concur with you on that, and we are blessed to have the infrastructure as well as skillful surgeons to deal with the most complex of the cases. My next question is to Dr. Gujarati. Uh, One of the things which was a little concerning in the survey was that often people resorted to self medications, which also included taking painkillers without taking a doctor's opinion. Do you think this is something to be concerned about, and what would be your advice to patients in general when they start taking painkillers on their own?
In my opinion, this pandemic was an unprecedented scenario. So we can't really blame the patients directly for resorting to a painkiller when the pain was at its most severe. But having said that, you can't discount the fact that these painkillers, regardless of however refined they will pose a certain set of side effects, which is unique to that class of drugs. We being doctors, we are able to sort of you know assess the patient profile, his comorbidities, and give an analgesic according to the nature of the pain that is there. And like we typically a doctor is going to put in a lot of thought process into the medicines that are given to a patient with backache or a patient with knee pain. And NSAIDs or painkillers are not the be all and end all of it. So somehow, although I discount the fact that in severe pain and in presence of the pandemic that was just going from just going higher and higher, people were justified in taking a painkiller or two. But once you get into the habit pattern of neglecting yourself, the disease keeps getting worse, and you have created a problem for yourself other than the disease itself. And often, what looks like innocent backache may have some underlying pathology which may become worse as the time goes by. So frankly, other than COVID pandemic related issues which are directly to the respiratory system, I think for the next couple of years we are in to see a lot of unforeseen musculoskeletal issues as well. And one of them may be related to excessive painkiller use over the counter.
No, I agree with you. I think taking an occasional painkiller is not a problem, but it is the unrestricted use of painkiller medicines without medical supervision which is a problem. And my personal experience has been patients coming with renal failure, or patients coming, or patients having peptic ulcers because of taking prolonged NSAIDs without medical supervision. My next question is for Dr. Malhan. We found that about 40% of our respondents, they did make time to do exercises during this period, but the other 60%, either they did not have the time, or they were not able to sustain their efforts when they started exercising. Now we know that yes, there were problems, the gyms were shut, the swimming pools were shut, but then is that enough? And what could Mumbaikars have done otherwise in order to keep themselves fit and healthy during this period of the pandemic?
Yeah, I think daily exercise is extremely important. And as you yourself said, that the gyms were shut, the pools were shut. But if somebody needs to do that exercise, there are ways you can do it at home. You can do, freehand exercises. In fact, there was a lot of stuff going on online in those days.
Yeah.
So, a lot of people actually guiding you to do exercises online, a lot of yoga classes. In fact, some of them are still on and they're getting a good business about it. The issue is that, but there were so many personal issues which people had. And as you said, there may be a lot of people who actually truly did not have the time, the work pressures, the home pressures, the household, pressures, looking after the kids, and that probably limited a lot of people. But as I tell everybody that to say simply fit is not really very difficult. You don't need to do a lot of fancy exercises. And as I tell them that you need to just class your exercises into stretching exercises, which I find are most important, because a lot of the patients who presented with trouble was due to lack of stretching. Patients complaining of cramps, tightness of muscles, myofascial pains. A lot of these are related to lack of stretching. And when you talk about poor posture, again, that is an issue which can be tackled with stretching exercises. The second thing you need to do is gentle strengthening exercises, and often you don't need a lot of equipment for simple strengthening exercises. You can do isometric ones which don't really need any movement in the joints also. So you have patients, a lot of our patients, as Sachin mentioned, who were waiting for joint replacement and could not do joint replacement. And these are patients who needed to do simple mobility exercises as far as they could, needed to keep doing the isometrics so as to at least keep the joints going and keep the health of the joint at least static at the level that it was and not let it get worse. So I think if people did stretches, a little bit of strengthening, that would have been fine. And a lot of people found the time to do it. Unfortunately, some didn't. And they probably paid the price to a certain degree for that.
I think you are very aptly put about the spectrum where people have not exercised adequately. But what about the other end of the spectrum? In your experience, have you had people who have come with injuries because they did not exercise properly, or some sort of overuse injury, some like an over enthusiastic performance of exercise, or inadequate warm up? What has been your experience about
Yes,
the other end of the
absolutely.
spectrum?
Yes, we've seen cases like that. I mean, you have seen extreme cases where people have now been doing all sorts of. As I said, there's a lot of online data, looking at YouTube videos and trying to do intense, and they have the time. And certainly, some kids, no college, no school, you have the time to do things, and you suddenly go all out and try to do things which you haven't done before. There's no trainer, there's no guidance. You're not, you don't have medical help. At least you don't have easy access to medical help because people don't want to go to the hospital. A lot of them did not want to go even within 100 yards of a hospital. So, I mean, with this kind of situation, we did see cases where people had injuries. We saw people with muscle tears. We saw people with ligament tears. We saw people with what you would call overuse injuries, doing things in the wrong way. And yeah, what you said is absolutely correct.
Yes, I agree. I think in the initial phases when little was known about the disease, there was a lot of fear. There was a lot of a sort of paranoia about visiting hospitals, and I think people did often neglect their muscle, bone, and joint related problems. My next question is for Dr. Bhosle, and we know how important diet is for every aspect of bone and joint health. And our survey found something interesting that about 6% of the patients, or 6% of the respondents rather, they chose to use ready to cook meals during the pandemic. And about 7% of them, they were dependent on food delivery. We know how big the food delivery business is now. But then there is always concern about the quality or whether these meals are healthy. Could you please elaborate about how poor diet or poor dietary choices can have a bad effect on an individual's bone and joint health?
Thank you. Uh, yeah, when the pandemic started, I noticed that it was people were excited about Amazon deliveries and various types of deliveries coming at home, trying out new foods, YouTube channels, cooking themselves, and consideration for health went for a toss immediately. So people were more excited about trying out something exotic, something new, rather than they're having sabji, roti, dal on a daily basis. They didn't have the cook coming in through. But what happens is ki, you are sitting at home, not exercising enough, you're not going out to work, and you are having fatty meals which are rich in carbs and fats, is no good for your cardiac health, bone and joint health. So, in addition to lack of exercise, unhealthy diet made your joints worse, made your bones worse, and did all sorts of negative effects on bone and joint as well as cardiac health.
Yes, I think obesity has been something a concerning problem, especially post pandemic. We are having a lot of people with significant weight gains, and obviously, this excessive weight is having an effect on their joints as well. My next question is to Dr. Gujarati. I think our discussion cannot be complete if we do not talk about the link between the pandemic and vitamin D deficiency. So, in your experience, I'm sure you have seen plenty of patients with vitamin D deficiency. Could you tell us how this problem has become worse because of the pandemic, and what are your patients presenting with, and how do you address this issue?
Yes, exactly. When you started talking about nutrition, the first thought that came to my mind was the rampant epidemic of vitamin D deficiency that's making rounds these days. So it's very common for me to advise a vitamin D test for a patient with backache or a neck pain, or in general, a reduced joy of life. They don't find activities like maybe exercising or dancing pleasurable. They find easy fatigability and a constant feeling of tiredness. So I think in part what has been responsible, sun exposure, yes, to a certain extent, but other than that, consumption of constantly processed foods and lack of proper exercise has also led to this outbreak of overall poor feeling of energy levels. What I also find is that with reduced protein intake, people do end up putting a lot of put off a lot of weight on. They're constantly having processed foods. They're trying on pastas, pizzas, Chinese. None of these meals may have an adequate source of protein in them. And considering that a general adult will require 1 to 1.5 grams of protein a day, this is one of the more neglected parts. In addition to vitamin D deficiencies, again, coming back to vitamin D deficiency, we find that a more common source of vitamin D used to be cow's milk. But considering that these cows that are giving us milk have been giving milk for the last couple of years, I seriously doubt if they contain the amount of vitamin D that they are supposed to contribute to our diet. So that may be one of the unexplored part why suddenly vitamin D levels are so low amongst the general population.
Okay. Now, one more thing I would like to ask you. You might have seen a lot of patients who come to you and they would tell to you that we have been taking this 60K vitamin D every month on our own. Now, what is your take on that? Are you okay with patients taking vitamin D without supervision, without getting their levels checked?
Well, you are right. I have to discourage patients who keep doing that because there is something called hypervitaminosis D. Generally, it will not happen because vitamin D itself is a fat soluble vitamin which gets stored in your body and mobilized when required. But what happens where people actually go wrong is a low vitamin D level by extension means that your calcium levels are also low, because the main job of vitamin D is to absorb calcium from the GIT and deposit it to all the cells in the body, be it muscle, bone, or so on. So, unless you supplement your vitamin D with additional dietary calcium, either through food or through medicines, I believe sole correction of vitamin D is somewhat ill advised. And we need to supervise this, we need to monitor this. And for a person who's been taking monthly vitamin D for a very long time, we should not hesitate to order a vitamin D level just to see what is his current level and whether he can stop the medicine.
I think you have very rightly put. That is what I follow in my practice too. That I like to have the vitamin D levels before I supplement them, and I definitely discourage patients from taking unrestricted vitamin D supplementation for prolonged periods of time. Uh, One more thing which I think we must discuss, although this is not directly related to work from home, but this is a significant problem which we have seen recently, and that is the increased incidence of patients presenting with hip joint problems. And all of us know now that it is related to the use of steroid medications in the treatment of COVID patients during the pandemic. So, Dr. Manish Sontakke, can you please share your experience about patients presenting with hip joint problems who have consumed steroid medicines during the pandemic?
Yes. In fact, I would say that steroid has been the center of part of treatment of COVID infection. But the rational or irrational, you would say the amount of steroids patients have received over a short period of time is a very big dose, and that has greatly increased the incidence of avascular necrosis or hip joint problems, say pain in our patients. So we have a patients ranging from as young as 18 years to as old as 65 years who have presented with hip pain, with disability, with difficulty to walk, inability to squat, inability to sit cross-legged within 6 months of receiving these treatment, and we are still managing these side effects now. So the patients who have come at the early stage, so we could within the first or second stage to a of this avascular necrosis, we were able to salvage their hip joints during this time. But some of these patients who had advanced arthritis had to undergo joint replacement surgery for that. So many of the younger patients who had neglected this problem and they were living with joint pain as a part that it was a part of a COVID infection that has induced this pain, and have suffered a lot because of this. So the incidence of avascular necrosis or hip joint pain that was initially, I would say, around 4 to 5% of the population is almost double now to 8 to 10% of the population now.
My next question is for Dr. Bhosle. Now, because of this problem which is now existing, what is your advice to people who usually would have, there is usually a tendency that if they feel some pain in the hip region, initial tendency is to probably overlook as some muscle twinge or some sprain and think that it could not be anything relevant. So, what is your advice? Do you ask them to be a little more cautious? And in your own practice, is your maybe the threshold to order tests like MRI immediately in such patients gone up?
Thank you. That's a very nice question. because definitely post COVID, one of our COVID task force doctors, Dr. Rahul Pandit, had much earlier said to me that Sachin, you are going to see a surge of avascular necrosis, which has also been popularized as bone death in our media. Now, I have really seen that there are young people coming up with hip pain. What we doctors have to do specifically is to specifically take the history of COVID from the patient don't always say that yes, I have had COVID, yes, I have had steroid. Majority of them, after asking, will give you the history of having suffered from COVID, and then they'll say that I don't know what medicines were given. I asked them to come up with a list. And yes, in young people, I have got a much lower threshold of doing a MRI scan, because then we have to grade the avascular necrosis from 1 to 4, and we have to predict the outcome. We have to ask them to stop impact activities. We have to ask them to reduce weight. We have to get their calcium, vitamin D up to par, make them realize that this is going to stay with them for many years. And if we have to manage it without surgery, they have to really comply and follow up correctly. So that takes a good 20-25 minute counseling consultation with the patient, with normally a good outcome, because majority of them are stage 1 or stage 2 AVN, which can be pulled off without surgery, unless we come up with some new other guidelines.
No, I agree with you. I think timely MRI is very essential to pick up the problem in the earlier stages where it can be managed with medical treatment or a less invasive treatment other than a joint replacement. And I also agree with you. I think there is a little concern about patients revealing whether they did have a COVID infection in the past, and their inability to tell us whether they received steroids or not. Because typically, I find that a lot of patients tell me that they had received treatment at perhaps a jumbo center or somewhere, and they do not have any written records of what medications they were given. So it is really not possible to know whether they had actually taken steroids or not. Now, my next question is to Dr. Malan. A little unusual. Now, we have discussed the findings of our survey. Now, one thing is that 65% of the respondents were females. Now, would you think our findings would be any different if we were to look at the males and females separately in this survey?
Yeah, possibly. I think there is a difference in how women and men perceive pain, how women and men perceive exercise, how they perceive food, activities of daily life. And I think all the importance about this period was that it was very simple things in daily life which we often take for granted, and these simple things actually made the big difference. The lockdown was a cut down of normal life to a completely new level, and I think it does make a difference. And perception of pain, as we know, I mean, there's a lot of data to show that even perception of pain between men and women is different. And certainly there might have been different if you had a larger number of men answering the questionnaires.
So, before we conclude, I would like to take closing comments from each of our panelists. I would like to first start with Dr. Gujarati. Could you tell us what would be your message to Mumbaikars, based on the findings of our bone and joint health survey?
Yeah, thank you. So basically, I find this survey to have raised a lot of a lot of awareness about the impact of pandemic in the long run. Also, we have increased awareness about ergonomics. Now people are looking at the way they sit, how they sit, and more importantly, like say, there is always certain population which gets excluded. Like you pointed out just now that 65% of respondents were women. So the data might be slightly different, or something new might be learned from patients who, if they were more men. Similarly, I believe that a lot of people suffered from backache because the conventional modes of travel were not available. Like people used to travel previously by trains, now had to resort to roads which were always jam packed during the semi unlock that happened. And suddenly there was a big spike of backache coming in, because of this extended long duration of traveling in a compromised kind of way. So I guess as time goes by, we are going to see different facets, like I already said.
Right. Okay.
Yeah.
Dr. Manish Sontakke, would you like to add to this?
Yes, thank you. The lockdown has taught us a lot of things. It has taught us how you are going to live your life in your future. So predominantly, one thing Indians have to, or Mumbaikars, we are a very fast-paced city. We have to work, we have to run here and there. My major concern is that our major lifestyle changes have to be there. There's no time for exercise for anybody. So to walk normally, you need a good spine, you need a good knee. So basically, everybody should know how to do a basic back and knee strengthening exercise. They should exercise regularly. Regularly, it should be a part of life. At the same time, eating habits have to be healthy. They have to avoid addictions. They should maintain their weights because soon the insurance companies are also going to ask you to show 20 hours of gym for every month if you want to claim your insurance. So, so actually, it's a major lifestyle change that they're going to need. Yeah, it has definitely taught us a lot. Thank you.
I think yes, definitely there will be a focus on diet, exercise, and lifestyle changes. Dr. Bhosle, any concluding remarks?
Yes, thank you very much. Two things here. The pandemic has taught us to be self-sufficient. Let's be happy, self-sufficient, and let's not be afraid to seek medical helps. Because if things are getting quiet, let's concentrate on our health as well as mental health. Be healthy and happy. Thank you.
And Dr. Malhan, any last words?
Yeah, I think the survey and the pandemic has simply brought out to the four things which are always there. These are not new problems. They have always been there. It's just that it suddenly happened at in such a large scale and such huge numbers that it all came to the fore. I think it taught us the importance of a work-life balance. I think it taught us newer things of how to do things in a better way, more efficiently. So we are much smarter than we were. Your survey brought out a lot of things about exercise, about food, which are not new to us, but I think we learned to give it more importance now. So I think we are smarter today than we were, and let's make the best of it.
I think that has been a very informative session. And to conclude, I would just like to say that of late, yes, there has been a lot of awareness about bone and joint health problem in the media, but it still appears that bone and joint health is still not a priority for a lot of Mumbaikars. The reason could be many. I speculate that it could be perhaps lack of time from the busy schedule, or it could be because people are not aware of how disabling the long-term consequences of poor bone and joint health could be, or it could be a reflection that the survey was mainly done amongst a younger population, so perhaps the effects are yet to be seen in this group of patients. But whatever the reason, I think it is high time that people of Mumbai start taking their bone and joint health seriously. The World Health Organization defines health as a complete state of physical, mental, and social well being. We know that without physical well being, it is difficult to achieve mental and social well being. So, that makes physical well being very important. And for physical well being, bone and joint health is of paramount importance. With this, I conclude the session, and I would like to express my heartfelt thanks to all my co-panelists who have provided their valuable time and invaluable insights during this session. I would like to thank the respondents of the survey for giving their feedback, as well as the audience for attending this session. I would like to, last but not the least, would like to thank the teams at across the Fortis hospitals for conducting this survey, collating, analyzing, and giving us this information. Without whose support, this would not have been possible. With this, I close this session. Thank you very much. Stay safe and take care.